All right, let's get started. Hi, everybody. I'm Jinhua Zhao, Professor of Cities and Transportation at MIT. Welcome to the MIT Mobility Forum, organized by the MIT Mobility Initiative. Today, we'll examine the nexus between transportation and health. How we design transportation system has a direct impact on our physical and mental well-being, from air quality, active lifestyle, to access to social activities and healthcare facility. This interaction is not just about moving people, but about improving lives. We're fortunate today to have Professor Daniel Rodriguez from UC Berkeley to join us today. Professor Rodriguez has been at the forefront of research in this area, exploring how transportation and land use influence health outcomes. His work provides essential insight into how we can create transportation systems that promote healthier and more sustainable community. Professor Rodriguez will share with us how this field has evolved, what the challenges lie ahead, and where opportunities for innovation and collaboration exist. So let me reiterate the norm of this forum. Everyone contribute one idea. I refer to the audience. So everyone, please write your thought either as a comment or a question to Professor Rodriguez in the chat. And we have the third section where we'll curate this question and comments to Professor Rodriguez for response. So before I formally introduce Professor Daniel Rodriguez, I do want to do one more exercise in the chat, which is I invite everyone to type one benefit of transportation that improves health. One benefit of transportation that improves health. Yeah. What do you see as transportation contribute to the health outcome here, right? I'll give a minute for people to digest and put your thought into this. Let's see how much ideas we can collect. Meanwhile, let me introduce Professor Daniel Rodriguez is the Chancellor's Professor of City and Regional Planning at UC Berkeley, where he directs the Institute for Transportation Study. His research focuses on the relationship between transportation, land development, and the health and environmental consequences. Professor Rodriguez's work is driven by practical problems and finding solutions for planners and policymakers. He has examined how changes to the physical attributes of the environment, such as the location of a bus route, rail line, supermarket, trails, are related to the changes in individual behavior, health, and air quality. His work also examines how land management tools can be used to encourage transit development and recapture the property value increases by public action. In addition, Dan is also a faculty fellow of the Lincoln Institute of Land Policy. Without further ado, let me pass the forum to Professor Dan Rodriguez. Dan, please.
Great. Thank you very much, Jinhua. Good morning, afternoon, evening to all of you. I hope you can see my slides being projected right now.
Yes, very well.
Great. Thank you. Thank you to John as well and to Bhuvan for making this forum available. I am delighted to see so many familiar faces and names showing up in the screen. It's great to be back. So today I wanted to talk about two main things. I wanted to first, about half of my presentation is about the origins and the establishment of this growing field or subfield of transportation and health. And then talk about my own take on emerging opportunities and options towards the future of the field. And if I go back to the origins of this field, it's really about environmental and health. So we go back maybe to the second half of the 19th century, Industrial Revolution. Cities are growing quite rapidly, and urban mobility is characterized by horse-drawn carriages, maybe the horse cars, streetcars that are pulled by horses, and emerging subway systems. And so you see here kind of this image of the London Underground in the 1860s, where it is powered by coal-fired steam engines. This is not very deep down into the earth, the Circle Line, the District Line, having these chimneys or kind of areas where you are able to have blowholes so that the coal byproduct of burning it, the soot and the smoke, is able to be exhausted. So air quality is one key element, and we were trying to adapt our mass transit system to some of these air quality concerns. Of course, it's not the only one. If we, about the same time, think about the horses themselves and the interactions with pedestrians, safety is also paramount. Eric Morris, who's a professor at Clemson University, kind of recounted how at the beginning, very beginning of the 20th century, in the 1900s, New York City had about 200 pedestrian deaths from interactions with horses and horse-drawn vehicles. And he contrasted this with about 350 deaths at the beginning of the 21st century. And given the differences in population, his point was that the per capita mortality rate was much higher in the earlier 20th century than it is right now, and made similar comparisons to Chicago. Others, like historian and engineering historian Pete Norton at UVA, advises us that these comparisons are not always appropriate and can be downright misleading. But at any rate, I think questions about safety were kind of prominent as the field was emerging, and related also to kind of this main traction source, horses. The other concern was waste. And so there's another environmental health aspect to this. An urban workhorse would produce between 20 and roughly 40 pounds of manure a day and about a gallon of urine. And if you think about 300 to 500 horses per square mile, you do the math and there is so much fertilizer you can do. And so cities were quite adept at trying to manage this by hauling it away, in some cases just pouring it into rivers, but it was a great concern. And if you look at kind of the historical accounts, London, New York City, Paris, they're all having to deal with these challenges. Manhattan, for example, had crossing sweepers. These are folks that would offer services to pedestrians, basically clearing out the path. Of course, when it rained, things got ugly. But all this manure also pulverized into dust when it was too dry and attracted rodents and flies. And in fact, an interesting historical piece here, the New York Department of Street Cleaning was started in 1881. That became the Department of Sanitation. It was the first department that would think about kind of removing waste, not only horse waste, but household waste, uniformly throughout the city with regard to income or race or background. So this is kind of the beginning of cities thinking about providing services to their citizens surrounding this issue of environmental health. From here, health followed what I would call a kind of a pathogenic approach, thinking about health pathogens towards improving public health, whereas engineering followed a much more optimization and maybe rationality approach, a much more positivistic approach. We move kind of to the middle of the 20th century. This is the period what I call growth or establishment. And really what characterizes this period is acute events that magnify the connection between transportation and health. What you see here is a picture of the Great Smog of London in 1952. Of course, personally, and for some of you, it also draws connection to the wildfires and the smoke that many of us have experienced maybe over the past 5 years or so, either from smokes in my case in California, for some of you, smoke in Canada, or other places that have come and left this kind of really ominous environment of kind of fog and the sun being orange. In this case, it was a thermal inversion process that captured a lot of the smog that comes from, number one, the internal combustion engine, number two, from coal-fired power plants, and from coal-based heating in the houses. This is a 4-day period, the Great Smog of London, in December 1952. That was roughly estimated to claim between 10,000 and 12,000 lives. Of course, London's poor air quality was not new. This was an issue since centuries before that. But this was many times worse than what anyone had experienced. It was the worst period of air pollution that the UK had been through, and really triggered environmental research, government regulation, and awareness between the relationship of transport and health. This was the direct cause of the Clean Air Act of 1956 that was roughly 14 years earlier than our initial efforts in the US to deal with cleaning our air. Another related acute event that is persistent but was growing more and more acute has to do with our increase in road mortality. Of course, at the same time as this increase was occurring, our miles traveled was increasing even more rapidly than what this graph suggests. But still a major concern, reaching almost 55,000 deaths per year. And you see on the right-hand side, of course, the U-turn that has many researchers and policymakers vexed, especially from pedestrians and bicyclists, and our kind of return to maybe high levels of death that we're trying to understand and explain. I also want to highlight another kind of a mortality and morbidity set of research questions that happened at the same time of this growth and establishment, which was triggered by the First and Second World Wars, which has to do with hospital access and access to healthcare services. And so this is more about the role of transportation in emergency care and taking people to and forth healthcare centers, and at the same time flipping this and thinking about the location of hospitals and care centers relative to where people live, and thinking about optimizing the coverage in order to improve health outcomes. And now we move to the end of the 20th century, beginning of the 21st century, in this very fast review of the growth of this field. And what characterizes these last 25 years is really a focus on not only the acute episodes that I described earlier, but also a focus on the chronic episodes, the chronic diseases. And so you see here a variety of different outcomes. So we're starting to go beyond mortality to think about morbidity. So questions like time spent in cars and how that is related to other elements, mental health, diabetes, metabolic health, obesity. You see the various headlines and highlights here on the right-hand side of some of the earlier studies that kind of started defining the field in these 25 years. To give you a sense of how this looks like, here is just a recent snippet of a paper that we published last year. This is looking at NO2 concentrations in about 50,000 Latin American neighborhoods. This covers about 500 million people. And we have the different concentrations with each dot showing each neighborhood and the annual concentration estimated from satellite imagery. And the red dotted line that you see horizontally at about 5.3 parts per billion, which is roughly 10 micrograms per cubic meter, reflects the current WHO guidelines of concentrations. And so that's what we should be aiming for as policymakers, if you will, to reach appropriate outcomes for health. And so clearly you see the vast majority of neighborhoods exceeding that value. The dotted gray line on the top at roughly 21 are the guidelines that were in place before the year 2021. And so it was a move to tighten those guidelines and maybe prompt action to improve air quality, specifically NO2 concentrations, partly from an understanding of the effects that they have on health. How this links to transportation, of course, is a matter of interest to me. And so when we look at correlations between these neighborhood concentrations of NO2, like what we did in this paper, and transportation, we found that, no surprise, congestion at the city level and level of motorization are positively associated with higher concentrations of NO2. So herein lies the challenge. In Latin America, in this case, a context that has kind of very different levels of motorization, some that look much closer to the US with 500, 600, 700 vehicles per 1,000 people, and others that look less similar to the US, maybe more like European or Asian cities where you have 200, 150 vehicles per 1,000 people. During these 25 years, from the year 2000 to 2025 or so, we also have an increased understanding of the role of active transportation for health. Most of the evidence will look like what I show in the upper right-hand side. Is a dose-response relationship. The more you walk or are physically active, the lower your risk of dying from any cause. It's also not a uniform slope. You have a much stronger effect on the left-hand side of the curve. So moving from being a couch potato to being a little bit more active gives you much more benefits. And on the right-hand side, in this top right-hand curve, you see the effects from cycling. A little attenuated, perhaps from concerns around road safety, maybe increased exposure to pollution, but still kind of the same type of curve with a decreasing risk, but at a decreasing rate. And the bottom here, I think it's the increasing realization also that walking matters not only for walking itself, but walking for many other modes of transportation, like transit. So this is a very quick summary that highlights the importance of walking for health and for public transportation. So when we looked at these three countries, again, roughly 50, a little bit less than 50 million people, and how much walking happens? Roughly 1 out of every 2 persons in these household travel surveys makes a full trip by walking. By that, I mean kind of starting and ending at a destination, no other modes of transportation. You're just walking from beginning to end. In reality, of course, people maybe walk to a place and back. So maybe 1 in 4 people are making about 2 trips a day on average. But if we add the walking that is incidental to other transportation modes, think about walking to transit, walking from transit, maybe transferring from one mode to another, those numbers look quite different. This is what we call the stages, different stages of a trip or parts of a longer trip chain. And the number of trips doubles, and the amount of physical activity that people engage in just from walking, in some cases, almost triples. If we look at how much does this represent at an individual level in terms of agreement with or meeting guidelines of physical activity based on WHO, which are about 2.5 hours a week, we find that almost a third of respondents meet the physical activity guidelines just from walking to and from transportation, which again, this goes back to the importance of walking for transit and the importance of transit for health, a benefit that is not always accounted for as we think about transit's benefits. The move has also meant thinking about injuries, not only road fatalities. And as many of you might know, in the US, we have a great fatal crash reporting system that is uniform and has improved our ability to understand fatal road crashes. But we don't have that for injuries. There's some improvement. CDC now has an emergency department surveillance and monitoring system that captures a small slice of road injuries, only those that result in emergency department visits. But there is a clear need to be able to document injuries much more comprehensively and decrease the burden that this have on health. This is also the genesis of kind of the Vision Zero movement worldwide and the connection to reducing injuries beyond simply the fatalities. The second point I wanted to make that has also developed in this past quarter century has been the inverse relationship. So how health affects our ability to get around, either from disability, maybe low vision, maybe other mobility impairments that might limit our chances of getting to places. And so how our transport system might need to be modified to allow a minimum level of access to be able to realize our goals and visions, but also well-being concerns and chronic diseases that might limit our ability to get around. And so that is kind of a flip side also that has provided a much more nuanced picture. Institutionally, just to highlight what else is happening at the same time, I would say in the US, roughly 2012, the TRB, the Transportation Research Board, started this joint subcommittee on transport and health. So it was kind of shared by various committees. If you fast forward to 2020, on the right-hand side of your screen, the committee was approved. It's up and running. It's very successful. It's attracting a lot of attention. And in the middle here, you see the launch of the Journal of Transport and Health that now is a really kind of prime outlet for work on this emerging subfield. I want to highlight also, if you have seen the critical issues in transportation that the TRB Executive Committee put out this year, transportation is one of the 5 issues that are critical. I'm sorry, health is one of the 5 critical issues to transportation that they highlight in that report. So again, those connections that are becoming much more important and visible to this field. And let me now turn to the other part of my presentation that is really kind of thinking about the future and identifying kind of priorities and some reflections. This is partly the result of a project that I was involved in. It's a cooperative research program project on creating a roadmap for transportation and public health. And that roadmap ended up identifying 44 research gaps and 120 plus research needs, from a literature review of peer-reviewed work, of grey literature, a number of semi-structured interviews that is focused mostly on State Department of Transportations and kind of state agencies. And so we wanted to take some of those and kind of distill them into a smaller group of questions that maybe were a little more actionable, more self-contained, and that had a broader view beyond what a state agency would be interested in. And that's a publication that you see on the right-hand side, which is 20 research questions that emerged from this type of work. So I wanted to reflect on these 20 and kind of share some ideas that I think are important in the next few slides. So I'm categorizing them here in these rough five groups. I think in the paper we ended up talking about 6 or 7 groups, but they're all kind of contained. The same questions are contained here. And I want to highlight some ideas in each of these research priorities. Again, these might appeal to you because you are in a research function or in a policy function or in a support function at various levels, right? From local to state to federal to maybe a development bank. So the first item is really the measurement tools and models aspect. This is the more quantitative part. And so the challenge here is, how do we incorporate health and health equity impacts into many of our modeling tools, from travel demand models to travel demand management calculators to state and planning organizations, MPO performance measures, to the tools that are used to screen or evaluate or select projects. As I mentioned before, how to harmonize these non-fatal crash surveillance programs and create a much broader picture of that burden. And also thinking about the climate effects, but a little differently from how traditionally this has been thought in transportation, which has been how is our infrastructure exposed to maybe extreme heat or flooding. And it's thinking about how our infrastructure is actually exacerbating or amplifying some of these effects. Including heat island, including flooding. So this is the contribution of our transportation infrastructure to the challenges that many of our communities are facing. In terms of planning activities, some of the key questions that we were interested in and highlight was, well, how do we incorporate health into household travel surveys? This is a very practice-focused type of question. Some MPOs, Nashville comes to mind, have done great work in doing that. Others a little less so. And so bringing health to the fore, we think, is going to be very promising for these types of MPO level activities. How do we incorporate health and well-being into economic evaluations of projects? How do we improve and communicate practices within and across agencies? We have these incredible silos. How do we create bridge programs so that agency staff and planning can come to the MPO or to the state DOT? How can we provide workforce training so that the awareness increases as a way to begin to change practice, to initiate that change? Transit, of course, very important here. I anticipated the question about the broader benefits of transit. Thinking about those benefits, mental health, disability access, to show system level benefits is important for public transportation. My sense is we've had a fairly narrow view of the benefits of transit. And how do we translate those health benefits into healthcare cost savings? I think that is going to be critical as we think about health and transit. In disaster planning and recovery, how can the policies that support infrastructure resilience can also account for short and long-term health effects of natural hazards? What are some of the co-benefits that are emerging from these types of policies and infrastructures? And in technology, this is, I think, much closer to some of the work that my colleagues at Berkeley do. How do we use advanced technologies for pedestrian, bicycle, and other types of transportation counts, speeds? What are the impacts of ABs on health? We're seeing increasing work on access, disability access, road safety. What happens with micromobility? What trips are getting substituted? What are the exposures of some of these travelers to different types of health concerns? see if I can advance my slide. It's not slide, not, oh, there it is. Took a little while. Okay, so I think to close, I wanted to highlight some of my personal spin also, my personal views on some emerging opportunities. And the first one I think is important in considering how mobility in transportation could be both a source and a refuge for differential exposures to environmental concerns. So here, I think the idea is how do we think about exposure throughout the day course? Our assessments of exposures have been fairly blunt, in most cases, assuming that we stay in one place, that we stay at home and we consider exposure from the home environment. People don't do that, right? We move around, we go to work, we might go shopping or to other destinations. Measuring these exposures throughout the day course will help us understand where transportation stands relative to other emission sources. And I think it's been this type of work that has been helpful in saying, geez, you know, how we cook at home is really important, or the chemicals in our carpets and our furniture are a main source of VOC. So expanding that to our schools, our work sites, our parks will be really important to think about exposures in space throughout the day course. Incidentally, of course, in my experience in Bogota, transit vehicles, for example, were a great source of PM exposure just because of the poor exhaust system, something that now has been changing, but that was one example of identifying an area of exposure during the day course. And related to the previous point, I think considering exposure not through the day, but through the life course. So how these exposures layer and accumulate. Often for transportation, we have this coincidence of effects. So we have noise, we have emissions, we have road space safety that happen together in space and time. And so this can help us identify particularly vulnerable moments and places of exposure, and maybe even the tipping points, because our susceptibilities and vulnerabilities are also different based on our ages, our backgrounds, and those layerings of past exposures. The other point that I want to highlight here is health impact assessments. I really think that we should continue to think about what are the health impacts of a variety of policies, build on this momentum to enhance health and health equity concerns, to understand how transportation policies affect health, especially the health of the most vulnerable, and how this can be communicated to decision makers so that we can make better choices. And the final point is to strengthen our ability to measure behavioral adaptations and how they impact health. I was really heartened to see Carlos Moreno talking about the 15-minute city. Proximity planning is important. It begets more walking and more cycling, but it also begets more exposure to air pollution, road safety concerns. Thinking about this in an integrated way, not to undermine the promise and possibility of these policies, but to improve them and to be able to be more surgical in our approaches to deal, for example, with the question of road safety or air pollution, to magnify the benefits of these broader policies. So let me just stop there, and we'll continue with the agenda. Thank you for the opportunity to present this broad view of kind of the past and hopefully the future of this emerging field.
Great, and thank you so much, Professor Rodriguez. Before I start my question, I want to encourage the audience again to type your question or comment directly into the chat. We have quite a time to really curate them to interact with Professor Rodriguez. I also see Professor Peter Jones from UCL here. Maybe in a minute, I'll prompt you to describe the new project you guys are doing in the UK as well, right? So maybe I'll start with a more personal question, right? So what enticed you to get into this field, the transportation and a health field? How do you get into this? And also maybe tie it into a more institutional question. One slide you showed that in 2012, the TRB, the TCRP, the different journal of health reporting to come out. But it's rather late, right? The problem you identified a long time ago, right? Beginning of the century, we thought, but why this field didn't come up until only 10 years ago? And both in the personal level and the institutional level, how's your response?
Yeah, Gene, well, thank you. On a personal side, certainly my career started in the early 2000s with a focus on what I would call more traditional transportation questions, right? Things about topics around metropolitan planning, excess commuting, BRT. And it was through my exposure to some of my colleagues in health that I got really interested in a piece of this, which was active transportation and the built environment. And through that, one thing that stuck with me was some of the tools that they were using to improve or to do pretty good research. I want to give a couple of examples. So my colleagues were very focused on the reliability and validity of the tools, the measurements that they were using, or the power analysis. Like, do we have enough power to be able to detect an association here and there? And as I brought the transportation field, I was looking, geez, talk to my colleagues, hey, how about the validity and reliability of this tool? And they would say, yeah, we piloted it. But I mean, can we describe the validity and reliability? No, not really. It's okay. We piloted it, and yeah, we modified some questions. So that was really attractive to me, was some of the scientific method approaches that we had heard in school, in our training, that were important, but that were not as implemented in planning. And how it kind of elevated the research in some ways. I think also health underscored some of the big questions that I had about transportation, and it's really about how it improves well-being, right? It's ultimately we do transportation is to help people do. You said at the beginning, Jinhua, to help people do what they want to do, to be better people, to be happy people, and this is well-being, this is health. Healthy people make happy people beyond the intermediate outputs of travel time or logistics costs and things like that. And so that was kind of the impetus to get into this field.
Yeah. Then how about the institutional side? Why society as a whole kind of responding to it so late?
Yeah. I think that's a very clever observation. And my sense is that the field was originally nested within the environmental health world, right? So you were seeing those studies in air quality journals. We understood also some health water quality journals, certainly accident and road safety journals, but less so in transportation. And I think it took some time for transportation researchers, and this is a broad generalization. Of course, some transportation researchers were working on this in the 90s and 80s, but to embrace it and say, hey, we need a home in transportation,
Right.
and we need to be able to speak to this from the transportation world, partly because if change is going to happen, it's going to come from within. It's going to be a little harder from outside. It needs to be coming from within. And this coincides with this focus on chronic conditions as well.
Right. So talk about the collaboration between the transportation engineers, city planners, and the public health professionals, right? What's your observation about this collaboration? Are we all pleasant, sweet with each other, or there's difficulties and people don't understand each other? People don't really emphasize the other side's contribution. What's your observation about the collaboration so far?
I think it's very interesting. You can see kind of a wide spectrum of openness to that collaboration that I think coincides partly with the various fields and with, I think, sort of the disciplinary training that we've had. To give you a sense of the obstacles, even the language sometimes could be a little different, right?
Right.
On the research side, I remember, I was trained more in traditional econometrics, so I knew about omitted variable bias, but I hear from the health and biostatistician folks, they're talking about residual confounding. And when I heard this, I'm like, what is residual confounding? It's the same thing. We're just using different terms for the same thing. And so there's a little bit of this sort of different language. Each field has different jargon and different practices. Those sometimes get in the way. And again, some people are a little more open to making those bridges. I don't think it's all hunky-dory. I don't think it's all happy. There's also some obstacles to collaboration. The way the funding works in practice, it's difficult. And often we're kind of steering a very heavy ship that has significant momentum. And so the change is mostly incremental, and that's a challenge.
Great, thank you, Dan. Professor Peter Jones, may I invite you to say a few words about the new initiative that UCL and other universities are doing at UK?
Thank you very much for giving me the opportunity. Yeah, it'll be starting in the new year. It's funding from the Medical Research Council, but it's a cross-disciplinary initiative to ensure that efforts to decarbonise transport, actually those measures maximise public health benefits. There are 4 universities involved: UCL, Birmingham, Southampton, and Leeds, and in all 4 universities we have a strong public health team and a strong transport team. And going back to the last point, we found in the past, there are difficulties in the 2 disciplines or areas talking to each other. And particularly when you go into practice, a transport planner has no idea how to penetrate the health sector in terms of who they should talk to and what language they should use. So a big initial emphasis will be on trying to agree a common language and a common framework. And then particularly when it comes to appraisal of transport schemes, to actually enlarge that, to actually see how we can design them to maximise public health benefits, and also have an evaluation framework that will be able to do that. And we're looking at past case studies. We're going to be doing our own initiatives, including some laboratory work, looking at things like interactions between cyclists and pedestrians and things like that. So just about to start in the new year. But it's designed to be a hub to actually provide a centre of interchange and ideas and so on. So if people would like to email, I'll make sure you're on our lists and see if we can possibly collaborate. Thank you very much.
Great, thank you, Peter. So last question from me to Professor Rodriguez, and then pass for John for the question answers from the audience, which is there are different layers of institutions, right? There's a municipal one, there's a state, there's a federal. It seems to somehow segmented to take care of different parts of the transportation system or healthcare system, right? So Dan, maybe I'll ask you 2 questions. One is just positively, who's doing what? Just give us some general picture here. And then normatively, do you think the current allocation responsibility reach a reasonable optimal level, or there actually we should look for better design of such institution structure?
Yeah, Jinwo, thank you for that question. And Peter, congratulations for that work. This is exactly what needs to happen, is to get the different parties on the table and have this exchange of both practices and ideas and evidence. And immediately, in my experience, you will identify some enormous gaps that will be that need to be tackled in order to inform practice. And so, Jinwo, to your question, thinking about the different levels at the street level, communities have this very clear, and this is the type of opposition or support that they have for X project or Y project. They understand the layering of impacts. They understand the noise. They understand the heat. In these types of environmental exposures that might be exacerbated by transportation. In some cases could be mitigated with some transportation investments. And so I think they have it clear because of their lived experience and their exposure on a day-to-day basis. At the metropolitan level, depending on where you are in thinking about a US framework specifically, there's wide variation. Some MPOs have kind of a stronger independence because the funds flow through from the federal government through the state DOT directly to the MPO, and they have a little bit of wider latitude in terms of how that gets invested. Others have to work very closely with the state DOT and maybe are more confined to more traditional transportation projects. But even the more progressive states and MPOs are still, I think, struggling to incorporate health into a lot of their decision-making. You might have a leader that is visionary and says, health is important, we need to move in that direction, but it's the practice, right? It's the district engineer, is the local engineer who might not quite see it yet and feels a little uncertain about what this might mean for their practice. And so change in that context, I think, is quite difficult. At the federal level, I think we're seeing some of that, and I think this is really where the change could happen more easily. We've seen it through ICE-T, 1990s, kind of a broadening of how we fund transportation beyond roads. Fantastic. It happened a little later with transportation alternatives in the transportation bill. We are in a transportation bill year. And so that might be a place where the carrot, thinking about the US, could be dangled and the priorities could be reshapen in a way to further highlight the importance of health in transportation decision-making at the local level.
Great, yeah, thank you. So let me give the floor to John for the question answer. John, please.
Thank you so much. Dan, that was great. We had a really active chat with a lot of really great questions. So I want to just get right to it. Very early into your talk, Leo Alexandropoulos made the comment, what about walking or biking effects in a polluted metropolis? And this generated quite a few reactions and commentary in the chat, which, as Bhuvan said, we'll share with you. So you can follow that and the reports that were linked and so forth. But we wanted to give you an opportunity to sort of weigh in on that stream of thought, the balancing act between active mobility with air pollution.
Yeah, thank you, John. I think that's a very, very good question, one that I've struggled with as I think about low and middle income cities. And in my conversation with environmental scientists and exposure outcome experts, their general suggestion, and there's been a few papers from the 2015 to 2020 suggesting that the benefits outweigh the cost on average. For these dirty metropolis. That does not mean that in a smog day like the smog of London, or if you are doing this close to a corridor where you have significant diesel tailpipe emissions, for example, that I think I would have questions about that corridor. So there are some implications for the practice of where you concentrate bicycle activity. More importantly, I think that the questions are really about cleaning the buses rather than necessarily relocating where people are bicycling. But the evidence overall around safety and air quality exposures for people with high inhalation rates, people are walking fast, people are cycling, is that they tend to be on the net positive for the walker and the cyclist.
Super. Yeah. And that, I think that's commensurate with most of the commentary that we had in the chat. Chris Zegras from MIT raised a question. How about the climate crisis impact on active mobility, viability/comfort? So, as we think about efforts in, let's say, for example, Dubai, in a very hot environment to promote active mobility through shade structures and so forth, how do you think about sort of skating to where the puck is going in terms of, the climate crisis? And do you see that as a major threat for promoting active mobility?
Absolutely. And I would add two questions around, or 2 points around Chris's question. One is simply the thermal comfort or discomfort that is involved in sort of high heat situations, even if you're acclimated, because of the high temperature and the high humidity. It is just simply not fun to do so. And this is where kind of walking by necessity really is the only walking that you see are the people that maybe don't have a car and that have to walk to transit or walk to destinations. But the second point I wanted to bring that I also think is important, and we have emerging evidence around this, is the impact of heat on the behavior of both active transportation users and non-users. And so we're finding that as temperature rises, the mortality and the injury of motorcyclists, of pedestrians, and of bicyclists increases. And so you have kind of this U shape that is very pronounced on the higher heat environment. And with a doctoral student, we've explored what are some of the potential explanations for this. And what we found is that in the case of motorcyclists in Taiwan, in fact, this is a paper that's just coming out in Social Science and Medicine, motorcyclists are actually taking more risks as heat goes up. So we instrumented them with a variety of different sensors, and we found that they're accelerating more. They are following more jerky movements when heat goes up. They're taking more risks. It might be the case for bicyclists as well and for pedestrians. we just are wrapping up a study in Latin America showing pretty much the same, that as temperatures go up, road mortality goes up, and we have especially vulnerable users in walkers, in bicyclists, and motorcycle users.
That is really interesting. If you could share the links to those studies so that we can share them with our community. Very, very interesting work. Okay, sort of following the same stream, we had a question from Tane Deshpande, which is, are there any studies regarding how emerging economies could improve their transportation infrastructure for the better? For example, the time taken to construct and upgrade transport infrastructure in the long run could harm residents' health heavily in the short term. So I think there's a lot packed in here, but this connection of the built environment, that very long time cycle, the infrastructure component of transportation, how do you think about that connection with public health?
Yeah, I think it's a really good question, and nowhere is this more magnified than in some Indian cities, where you have a built form that is durable and heavily constraining. And as a result, infrastructure, for example, bicycle lanes, is going to be very difficult to implement. And you have a political structure that is not very favorable to non-automobile modes. And so I think it's a huge challenge when you have this durable infrastructure and you're needing to transform it to reprioritize. I saw in some of the comments here, I think it's a concerted change around other policies as well. So I don't think it's a matter of concrete and paint only. It's the question about parking, which is incredibly important. The question about gasoline prices, fuel prices, that we've also found incredibly related to some of these outcomes. And on that point, the health transportation connection is important in motivating change. In one study we did in Latin America, in 11 cities, we found that people that self-reported having a respiratory illness in the past 2 weeks were much more likely to support road pricing than other people. So again, this kind of said, geez, this magnifies the health aspect. You have just been exposed to, either personally or through your family, to some concern around health and air quality, and you're being asked about curbing car use. Very interesting. I think we need to line up the different constituencies that, for one or other reason, are thinking about a different template of mobility to improve this ecosystem of getting around through ways other than vehicles, cars, personal cars.
Excellent. Yi Wei asked, I think, a very interesting question that I was thinking about, which is, how does transport accessibility affect mental well-being versus physical well-being? To what degree? Is it more severe in one versus the other? I mean, for so often we've focused on physical well-being and that connection, which you very eloquently pointed out with the example of horses in New York City and so forth. What do we know about the mental health effects of mobility systems on people in terms of perhaps isolation, loneliness? What sort of research have you seen in that department?
Exactly. I would point to the work of Karen Lucas and others that have looked at social exclusion as a major determinant of well-being, right? Of low well-being and low health status. And so I think that there is, kind of paraphrasing others, there's kind of a minimum level of accessibility. There's a level of access that we need to function as individuals, and to the extent that our environment and our transportation options don't allow us to get there, we would certainly be kind of transport deprived, and that will show in many different aspects of our being. I just saw a comment as you were mentioning this, John, about kind of the dichotomy of mental and physical health. And I think it's a good question of whether this paradigm of differentiating between the two is even viable. And we know that the two are in fact one. And sometimes it helps us to differentiate. In other cases, it might be counterproductive. But there are multiple impacts of various aspects of transportation on mental health and well-being. Safety from crime is clearly one that vulnerable individuals and women, for example, experience on a daily basis, right? These behavioral adaptations, I won't go out at this time, I won't go on that route, because it's just simply not safe. And this has a toll. This has a toll beyond the behavioral changes, right? A physical/mental well-being toll. But there's other kind of more mundane things. Going back to another study, we've all experienced, maybe if you're a driver, that we prefer to be rolling, right? Being in stop and go traffic is particularly aggravating for individuals for reasons that we don't quite know, but we've all experienced it. In some cases, we take a longer route just to be moving. And we looked at commuting times and depression and self-reported depressive symptoms. So this is a screening tool on depression. And we found that, yeah, the longer people commuted, the higher the likelihood of them being screened positively for depression, which, it's sort of maybe not terribly surprising, but it was interesting that there was a clear association. But then when we took their commute and split it into how much distance were they traversing versus what was the delay due to congestion, we found that association was really driven by the delay, not by the distance. And so if people were stuck in traffic, they were much more likely to report these depressive symptoms than if people were simply just rolling, which coincides with this anecdote that many of us might have felt when we're driving in congested conditions. So yeah, there's many layers on the transportation system overall and how they affect our mental health and our well-being.
Yep. And totally understand that it might be a false distinction between mental health and physical health. I mean, that's a great example. We're stuck in stop and go traffic. We get super aggravated. It affects our stress levels, heart rate. It's not a good situation. I want to sort of connect to this larger question of the cost of, the negative cost on the health of society through transportation systems, which you touched upon. Evan Notley raised this question: do you have any guidance or best practices for transportation planners to better integrate epidemiological benefits into the business case for new transit projects? Do you see that now more of a trend where we're trying to promote the financial case for a transportation project, and we're trying to somehow calculate, into the cost benefit analysis, the health impacts, which of course are very, very difficult to quantify, but do you see us moving more in that direction?
Yeah, thank you. Thank you for that question, John. And to Evan's point, I think that we really need to operate at two levels. One is certainly at the local/regional level, when we're making the case for a given investment, and where maybe the Chamber of Commerce might be concerned or their support might be critical. I think there is a place there to sway decision makers and the communities about the health benefits and the health costs of these investments. Especially, I bring the Chamber of Commerce because the private sector often is either the private sector or the federal government, state government, having to pay the bill for the health costs, right? Through insurance rates, through Medicare, Medicaid. And so those are kind of the two main audiences that I think at the local level, you'll be talking to the Chamber of Commerce mostly. The federal level, that's the second one. I think it's really important that we think about kind of reforming how we evaluate projects, right? If you look at the FTA's analysis of cost effectiveness of various type of small and larger new starts, health is not a big element in them. It is under-quantified and misspecified overall, and we're really thinking mostly about travel time. Sometimes they track closely, but not always. And so I think that there needs to be work at that level to think about how to more comprehensively understand the health impacts of public transportation and the health cost. I mean, this goes to Thomas Frieden, who was the CDC director, who said, if we were to bottle physical activity in a pill, it would be a miracle drug, right? And I think this summarizes it. I think within transit, it is such a great way of letting us incorporate physical activity into our daily life, so that we don't need to make time outside of our busy lives to go exercise and be physically active. I think it will produce all these other benefits. This raises other concerns about equity, right? And there are people that don't want to be commuting by transit. In low and middle income cities, that is very clear, right? If given the possibility of not walking so much, they would jump on it immediately. They do so. And so in those cases, I think the framework is, how do we encourage them to continue to be physically active while making this lifestyle change that is so valuable? A colleague of Universidad de los Andes has developed this framework about walking, bicycling for necessity versus choice. That is helpful in this distinction between having to walk or bike because it is so long or so expensive, versus by choice.
Thank you so much, Dan. I mean, there are many, many more really great questions and comments in the chat file. So as mentioned, we will share that with you.
Great.
Thank you. Dan was reflecting on the point of the appeal. Can we create the appeal of active travel here, right? In transportation, we have sometimes a dream, oh, let's solve the door-to-door travel problem. But from public health point of view, if we indeed solve the door-to-door travel problem, that may be a disaster for the public health perspective there. That's the excuse for many people still having the minimal level of activity there. Right. Yeah. But thank you so much, Professor Daniel Rodriguez. Everybody, please join me thanking Dan for the